Hello everybody, welcome to my second video. For those of you who don't know who I am, my name is Shantonia Lewis and I am a counsellor. And today we are going to be talking about depression again, but general depression. And like I said in the previous video, depression is something that's very common, especially now in the times of COVID. The depression rate is rising a lot more than it has previously, and that's understandable. So I'm going to just talk about depression and ways in which you can help to cope with it and to combat it. So let's get started. So depression there's different types of depression. I think in my previous video, I mentioned how it could be triggered by different things such as anxiety, eating disorders, schizophrenia, and even substance misuse. And it can also be triggered by anger, which is interesting. And I'm going to be talking about anger very soon, maybe in my next video. But I think with depression, if you feel like you have depression, like I said in the other video, depression isn't something that you wake up and just think, oh, I'm feeling sad today, I'm feeling really down, and maybe I'm depressed, because it can be often confused with sadness. Now, sadness is something that, I don't know, an example, you lost your favorite pen, or that's a bit lame. You've done something that makes you feel sad, and you're sad for a moment, and then afterwards you kind of feel a lot more better and brighter. With depression, it lasts for a long time. It can last for at least up to 2 years, or it could be short-lived, and it can be, you can overcome it within a few months. Now, there are different types of depression. You have like general, depression. You also have postpartum depression. Now, postpartum depression is the fancy name for baby blues. For those mothers out there, you probably feel, I have a baby, I've had one, and, I should be feeling happy. Now, the word isn't should, because it's an expectation that you are supposed to be happy with this little bundle of joy that you have, but unfortunately, you don't feel this way. And then, you probably have guilt coming in, and probably feeling frustrated with yourself that, I just feel detached from my baby. It could be due to this whole COVID time. It's difficult, or it couldn't, just looking at maybe your triggers. It's the expectation that mothers should be feeling happy and, overjoyed. But for some mothers, this isn't the case. And if that's you, definitely take the time to talk to your midwife, talk to your doctor about your struggles of bonding with your baby and not feeling that happiness that you are supposed to feel after having a baby, and the guilt that you may be feeling and all the emotions that you're going through. And definitely maybe try and get in touch with a therapist too, or a counsellor, and see if they can help you. And look at, your depression in that sense as well. So depression can also be triggered by different life events. Like I mentioned in the previous video, that could be triggered by bereavement, divorce, which are very common. So let's look at ways in which we can treat this depression. Oh, before we get into the ways in which we can treat it, I just want to note that the main symptom of depression is often called anhedonia. I think I'm pronouncing it correctly. I hope I am. And that word has different meanings. So it can mean that the person has a loss of interest or a loss of motivation, or that people may be interested and motivated to do things, but they don't feel that happiness, that joy that they usually get from it. That's what I wanted to mention earlier, I forgot. So for example, you could be enjoying doing the garden, or enjoying, usually your hobby is to play an instrument or draw, for example. But then when you are in this depressed state, you don't feel that that joy, that delight when you're doing the hobbies that you previously loved to do. So, you know, you have a loss of, you have a loss of that pleasure, so to speak. And when you do have a loss of interest and a loss of motivation, you don't feel you can do anything. You just, nothing makes you feel happy, and all that kind of stuff. There's also risk factors that you need to look out for in your loved one, or even in yourself, of depression, and we're going to jump right into that. So in some cases of depression, some people may be involved in self-harm. So they may, the motive for them isn't necessarily to die. It's just used as a way to express the pain and hurt that they may be feeling. However, there are times where the person does, self-harm, and the intention is to die. The intention is to, because I can't stand the pain and the hurt that they are feeling anymore, and they want to find a way to escape from depression. So suicide is also very common, and it's something to also look out for. You need to look out for factors that may increase suicide attempts, and that might be the use of alcohol, maybe to escape the problems that they may be going through. They may have a previous history of self-harm. They could be also living alone in social isolation, which could also increase the risk of suicide. Family disagreements could also be an anniversary of any losses that they've experienced. So a loss of a relative that they're very close to. It could also be suicide in the family too. That could also be a risk factor of suicide and things like that. Okay, so the ways in which you can treat depression, you can definitely go to a therapist, maybe try CBT and counselling. You can also maybe journal, and that's also very common to do. Journal how you're feeling, what's going on for you, and journaling can be very helpful for some people. It's not helpful for me at all. I tried journaling and I start and stop. So for some people who are like me, who journaling isn't for them, try something new, like a new hobby. Like listening to classical music is amazing. It helps you to feel calm and grounded. I know it does for me. You can also, do something different, like cook or bake, draw, have a go at doing art, have a go at, trying a new instrument or learning a new instrument, maybe learning a language. Like doing something different can also help you too with your depression. Talk to your family or friends who you trust, who can also help you, provide the help that you need and the support that you need as well. Again, in my previous video with the SAD, they can also be there to be all motivated to help you to do those different activities and to do things with you. again, also try and do exercise. That helps. And if you are on medication, try not to depend on that alone. Try and get the help that you need. I know for some doctors, when you do go to the doctors and tell them that you are depressed, they just want to just give you medication to help with it. It helps for a certain period of time, but then after that, it's that afterwards that you need the help when you actually do come off it. So definitely try therapy if you can, and see which therapy is right for you, and just go for it. Just seek the help that you need, because your therapist, the counselor, will help you with your depression, and help you on your journey, you know, with it, and help you to find ways to deal and cope with it. I think I've mentioned everything of ways to cope. Yeah, definitely try those things. See if they work for you. So yeah, I just hope this video helps you with depression and overall. And also, oh yes, I forgot a very important tip is to find out what your triggers are. So find out what's triggered you to go back into depression state. Like I said earlier, if it's a anniversary of a loss that you've experienced, if it's a family disagreement, if something's said or done that's triggered you, just find out what your triggers are. That also helps to pinpoint exactly what you can do to then overcome that trigger, and healthy ways to deal with it if you are triggered again by that, whatever triggered you. So that's also another important tip. So yeah, thank you so much for watching. I hope you've learned something, and I hope to see you guys in the next video. You know, like I said, seek the help that you need. Don't suffer in silence. Don't suffer alone. And there are people out there who are trained and who are willing to help you. So I hope you find the help that you need. So yeah, thank you so much, and I'll see you in the next video. Thank you. Bye.